Why do PBMs control Medicare Part D drug pricing? Imagine trying to buy a medication and wondering why the price keeps changing, or why some drugs seem more affordable at certain pharmacies. It all comes down to the role of pharmacy benefit managers, or PBMs. In Medicare Part D, these companies act as middlemen between drug manufacturers, pharmacies, and the plans that provide Medicare coverage. Their main job is to negotiate prices and decide which drugs are covered. PBMs negotiate rebates and discounts from drug companies in exchange for including their medications on a plan's formulary, which is just a list of covered drugs. This gives PBMs significant influence over which drugs are preferred and how much they cost. When they negotiate these rebates, they can lower the net price of drugs for the plan sponsors, which helps keep premiums lower for people enrolled in Medicare. Medicare Part D is designed to encourage plan sponsors to compete mainly on premiums rather than taking on all the risk of drug costs. Because Medicare offers reinsurance in the catastrophic phase and has a coverage gap, plan sponsors don't face huge financial risks. This setup makes them focus on getting the best rebates from PBMs to keep costs down. Often, the rebates are more impactful financially than upfront discounts. So PBMs and plan sponsors prioritize drugs with higher list prices but larger rebates. The supply chain in Medicare Part D is also quite integrated. Some insurance companies own PBMs and even specialty pharmacies. This vertical integration means they control more of the process, from negotiating prices to distributing drugs. This consolidation can give PBMs even more control over drug prices and formulary decisions. Recent changes like the Inflation Reduction Act have introduced new rules to lower costs, such as capping out-of-pocket expenses and adjusting how much beneficiaries pay. But PBMs still play a key role in negotiating drug prices and managing which drugs are covered under these new rules. From the Medicare administration side, PBMs help manage the complicated process of drug pricing and utilization. They negotiate rebates and control which drugs are on formularies, which can help lower premiums and out-of-pocket costs for beneficiaries. However, the prices you see at the pharmacy might not reflect the net prices after rebates, which can make the true costs a bit unclear. When Medicare plans review and change their coverage each year, understanding how PBMs operate becomes even more important. Plans relying on PBM contracts to control pharmacy expenses and negotiate rebates. They often adjust formularies and benefits annually to get the best deals and provide better coverage for enrollees. In the end, PBMs control Medicare Part D drug pricing because they negotiate rebates and manage formularies on behalf of plan sponsors. Their role is central to how Medicare keeps drug costs manageable while offering a variety of coverage options. Their influence shapes what drugs are available, how much they cost, and how plans are structured each year.